In this video, I am talking about when I started physical therapy after my midfoot fusion and bone graft for a Lisfranc dislocation. My first physical therapy session was on September 23rd, 2024, about 8 weeks after my midfoot fusion surgery on July 30th, 2024. You'll see in the pictures that I had a bandage on my right foot, and that's because the scar was still an open wound. The surgeon and one of my sisters, who is a nurse, were working with me to get the scar to close up. Because the scar was taking a long time to close, I was doing just range of motion for the first few weeks of physical therapy. I started physical therapy within a week of being permitted to begin partial weight bearing with my walking boot. Looking back, I am really thankful to my surgeon for being super proactive about having me start physical therapy, and also for him being in such good communication with a physical therapist to make sure that my program was meeting my needs after the surgery. On the first day of physical therapy, my range of motion was measured, and of course my foot and ankle were stiff from having been in the walking boot and being non-weight bearing for 7 weeks, but I had been doing some mild stretches to keep my foot from getting too stiff, and so my range of motion wasn't too bad in comparison to the left foot. I was given pictures of the exercises that I was supposed to practice every day at home, and when I went home that day after the first session, my foot and ankle were very sore from all of the movement. I had a lot of questions for the physical therapist, such as how to tell when I needed to back off from exercises versus when to keep pushing, so that I would know how to safely practice the exercises at home, and also how to safely continue practicing partial weight bearing at home. Sometimes it was hard to tell whether I was making any progress during the weeks that I was doing range of motion exercises in physical therapy. However, the combination of seeing a professional twice a week and practicing the exercise at home every day did wonders for the stiffness in my foot and ankle and truly helped prepare me for when it was time to begin strengthening. My husband, Matt, also said that he liked whenever I went to physical therapy sessions because he would see a difference in the way I was able to move around the house by the following day. In addition to the range of motion, the physical therapist I saw did also help me readjust my crutches to be better suited to the length of my arms, which made them much easier to use, and they helped me work on using one crutch during the partial weight-bearing phase so that I would be able to have use of one of my hands. This was something that made a world of a difference to me. Once the surgical scar on my foot closed up, I was able to graduate to strengthening exercises in physical therapy, which was when things got pretty exciting. My physical therapist and I were both looking forward to being able to do more sessions, and she had a lot planned for me. If you have physical therapy, don't be afraid to ask lots of questions. The more questions I asked, the more interactive and engaged my therapist became because she saw that I was interested in making the most of the knowledge she had. Some of the questions I asked in the beginning when I had range of motion exercises included: how can I tell the difference between when it's time to push through discomfort or when it's time to stop and exercise? What kind of things can I currently be doing at the gym? Are there weight limits that you think I should be having on those machines that I'm using at the gym? What kind of activities do you recommend I do at home to help with my recovery? Are there things I should be avoiding? Are there things that you think I should be talking to my doctor about at my next visit? As usual, thanks so much for tuning in. Feel free to leave comments with any successes, challenges, anything else that you have going on in your lives, and I look forward to seeing you all soon.